meeting after this. For those of you who don't know me, I studied this left and right. I've been studying it for 5 years. I wrote a best-selling book about it. Here's a couple of things we have to realize. That ever since we voted for this administration, we've been told nothing but a pack of lies. The first lie about the health care bill is a quote from our president, and he's only my president in name only, and here's what he said. He said, every American should have the same health care coverage that Congress has.
That's right!
Well, the only way we're going to have the same health care coverage that Congress has is if they sign on to this bill. And that's number one. First of all, for those people from Chicago here, how many people from Chicago? Do you think Mrs. O'Leary's cow was trying to tell us something? 94% of the UK, and this is according to Parliament, wants to go back to private health care. 86% of Canadians want to go back to private health care. I have two neighbors of mine from Montreal that came to this country, moved their businesses down here, and became citizens for health care. And now they're concerned they may have to move to Costa Rica. For those in the medical profession, this bill contains something that you're not familiar with. It's a little sneaky in there. It's called bundling. When you submit your insurance claims, when you...
Could you listen, please? You're a representative. You should be up here. You need to be listening. Not up
There is bundling in that bill, and what that means is that if you're a doctor and you have a practice, you're going to get paid 3 times a year. What do you do for cash flow? How do you run your practice? How do you treat your patients? You can't. How do you pay your rent? You can't. When I was in business, if we didn't have cash flow every week and every month, we were out of business. And anybody in this room that's been in business knows what cash flow means.
He does.
Let me explain something to you. We are going to be adding, from what I hear in this room, we are going to be adding 3 more people, and a couple of more, I'm sure, to the unemployment rolls in 2010, and they're standing right there. Let me just give a couple examples of that talk before. There's a suit pending right now because a doctor put his patient who was in her 8th month of pregnancy on bed rest to save the baby and her. She had the baby, everything was fine, he saved the life, he saved the baby's life. She's now suing him for excessive stretch marks, and the court is... God's honest truth.
That's true. That is true.
Now, there is a provision in the stimulus package to help alcoholics. They gave $6.5 million to a group of sociologists in this country to go to Hong Kong and teach prostitutes how to drink responsibly. That you can look up. That's a fact.
$100 million to Hamas.
Excuse me. Let me explain one more thing. There's only one thing that the stimulus package has done. It's stimulated everybody in this room, everybody who couldn't be here today, to stimulate their vote the other way.
We are disappointed that Representative here.
He's not here.
We have the age.
He's a coward.
Coward.
Last month I went to my doctor, and I really like him. He cares about my health. So I asked him about the President's health care plan. This is what he said. Among many things, just remember these as it respects especially senior citizens. Shortage of doctors and rationing.
Yep, that's right.
I would like Representative Klein to please address that and assure, especially senior citizens, that will not be the case.
Bullshit. Bullshit.
There'll be shortages. There'll be rations. There are shortages now.
I'll get to the end of the line.
Thank you. Just one final thing. This is off topic. Would you please ask Representative Klein to ask the President by letter, a personal visit, if he would release his long-form birth certificate?